In this video, I will cover what is the main cause of rotator cuff injuries that create bursitis in the shoulder. Expect to learn the following. What exactly is shoulder bursitis? What causes rotator cuff injuries to occur? Why do medications and injections make the problem worse in the long run? If getting surgery on a partially torn rotator cuff is a good option, and how to get rid of shoulder bursitis and heal rotator cuff injuries without injections or surgeries. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, sciatica, and hip pain. My focus is on finding and fixing adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick reminder, if you have neck, shoulder, sciatica, or hip issues, and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me, and if my insights can help, I'll be sure to get a video out to you. So let's just start with shoulder bursitis. It's a very common diagnosis out there for anyone that has shoulder pain. Essentially, all it's saying is that there's inflammation in the shoulder of the bursa sac. It doesn't actually tell us that where the problem is or what's going on, just lets us know that there's inflammation. So the bursitis is what I call the effect of the problem, but it's not the cause. The inflammation is happening for a reason, and a lot of times there's some underlying problems in the shoulder, in the joint, in the muscles, in the tendons, everything around there that is actually putting more pressure on the shoulder, and the bursitis is the body's way of trying to lay down inflammation to help heal it, but it's not actually the problem. And if you go after just the bursitis first and just try to get rid of the inflammation, but you don't get to the root cause of what's going on, it's never going to fix the problem. And then that bursitis continues to come back over and over and over again. So what causes rotator cuff injuries to occur? One of the most common injuries to the rotator cuff is specifically in the tendons, and the most common one is actually in a muscle called the infraspinatus, and where that tendon comes out is it inserts right here on the outside part of the shoulder, and a lot of times that causes a lot of issues in there. So what happens over time when your muscles get overworked, maybe with bad posture, maybe with working out too much, maybe some accidents or trauma, there's damage that occurs in there. And when this happens, the body doesn't get enough blood flow and oxygen to the area, so it thinks there's an injury there. So over time, it starts to lay down these little pieces of collagen, but they're not like fully developed yet, and they get inside the muscle. It's called adhesion. It's like glue, and it makes the muscle weaker and less flexible, which is bad enough. Now, the job of this muscle, the infraspinatus, is really to help move the shoulder, but provide a lot of stability and support from it as well, especially on the back part of the shoulder. And when it gets loaded up with that adhesion, it can't. So it then puts more pressure on the joint, on the cartilage, and the tendon. And a lot of times people end up having partial rotator cuff tears of the tendon because it's getting overworked, because the shoulder has to force itself through movement way too much because it's not getting the help that it needs from the muscles. Then in turn, that bursitis starts to get in there to help buffer the area and kind of heal it, but it's not actually doing that, and that problem just continues to get worse. Now, medications and injections, do they make the problem worse in the long run? Yeah, they do, because they're not getting to the root of what's going on. Yeah, the medication might temporarily take away some pain, but didn't improve anything. The injection might get rid of some of that swelling and some of that inflammation, but it didn't improve anything. Injections are even worse, though. They've shown in studies when you go in and get an injection, they actually can cause more damage to the joint, to the cartilage, and the tendon, and have a bigger problem down the road. So once again, they're getting rid of the effect, but they're not getting to the cause. It's not going to actually fix anything. Those treatments are really like your car's check engine light came on, and all you're really doing is turning the check engine light off. You didn't fix anything. That problem's going to get worse, and it's progressively going to get worse, and it's going to be harder to deal with down the road. So try to avoid medications and injections at all costs, because it's not actually fixing the problem. It's going to make it worse in the long run. Now, is getting surgery on a partial rotator cuff tear a good option? Really just depends. One thing that I always look for in a clinical presentation with my clients was there direct trauma to that area, or was there not? And a lot of times when there's direct trauma, maybe a fall, an accident, that surgery is actually going to do pretty good. They're going to go in there and actually be able to repair it. But most cases, and what I see, is no true mechanism of an injury. What really happens is just builds up over time. And like I said, a lot of times that tendon damage or that rotator cuff damage is because of the underlying problem in the muscle and what's going on. It's not actually the root cause of what's going on. So a lot of people get a rotator cuff repair, but they never fix the actual problem. I always say that think of the tendon as your thumb and it's stuck inside a car door. The car door is all that adhesion in the muscles around the joint. You can't give this a chance to heal up till you remove that. So if you do the surgery, you kind of pull the thumb out, but then that car door slams on it again. So getting surgery on a partial rotator cuff tear is really not going to be the best option, specifically if there wasn't a direct injury or trauma to the area. And lastly, how to get rid of shoulder bursitis and heal rotator cuff injuries without injections or surgeries. The best part is getting in there and getting the adhesion assessed and fixed by a true expert. So what I want to link up this week is a demonstration of me treating adhesion in the infraspinatus muscle, breaking that down, which in turn will store flexibility, blood flow, function back to the area and actually help that area heal and then take the pressure off the damaged rotator cuff, off the joint, and have long-lasting pain relief. So I'm going to link that video up right now.
And my first way to get my depth is going to be a lean with my body and a little push with this opposite pec. So I'm going to lean, push in, back out about 10%, and then my tension is going to be a lean with my body. I'm going to pause for a second, and then she's going to go ahead and start that motion. Go ahead. And it's called internal slide. It's just coming to me. Infraspinatus is a very important muscle in shoulder function, shoulder stability. It's really important anytime you're pressing or reaching or going to grab things, and a lot of times it becomes very dysfunctional. Now, a lot of therapists make a bad job with this because it's actually very superficial. It's not deep. All that's really between that is some skin, a little bit of subcutaneous fat, and then the muscle, and it sits right there. So what I'm going to do next is I'm just going to go a little bit lateral to that, and I'm going to be here, and I'm not going to use my hand on this first one just so you guys can see it. And what I'm going to get first is I'm going to get some depth with my body, and I'm going to back out about 10%, and then I'm going to get some tension about 1/4 inch into that scar tissue, and that's how I'm going to load that up. Go ahead. And it's called internal slide. It's just coming to me, and we're moving it. Keep going, keep going, keep going.
That's all I got for you in the video. If you've been dealing with chronic shoulder bursitis and a rotator cuff injury for at least 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us to set up an injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief so you can stay the hell away from pain pills, injections, and surgeries that only make things worse. All the information to request that consultation is included in our profile or wherever you're consuming this video. Appreciate you watching, and we'll see you on the next one. Bye.